Okay. Good afternoon, everybody. Good morning, depending on where you are. Here in Geneva, so it's just the beginning of the afternoon. Sorry for the little delay. It took us a bit of preparation to get started. So today we start the first episode of a series which is called Hospital Future Talks. And today with us we have Sonia Roschnik to unveil the story behind the future and of hospitals and health systems, their health systems. I'm going to tell you a bit of the about the background of the initiative, explain you a bit about the format, and then we'll give the floor to Sonia, who's our first speaker today. Thank you again for joining and spending some time with us. On Zoom, you have access to the chat, so please introduce yourself if you want, your name, where you are based, what organization you work with. We also want to hear about your expectations, so feel free to comment or recommend anything about this initiative. My name is Alexandre Robert. I'm the Health Program Manager at the Climate Action Accelerator. The Climate Action Accelerator is an NGO based in Geneva, and we are working on accelerating climate action with partner organizations and in health programs. Please visit our website for more information. Today, this chat is organized as part of the Future of Hospitals and Health Systems initiative, which was started by Sonia and a few other colleagues. This initiative supports hospitals in vulnerable settings to respond to the growing demand of healthcare in a sustainable and equitable way. It has started in 2023. Sonia, you will tell us more about the start at the beginning, and brought together a consortium of 5 organizations, the Aga Khan Development Network and their health service branch, the French NGO La Chaîne de l'Espoir, the Climate Action Accelerator, where I work, the French Development Agency, and the International Hospital Federation's Geneva Sustainability Centre that you co-founded, Sonia. And these partners were driven by a common vision, which is to support hospitals in low-resource and vulnerable settings to adapt their infrastructure, processes, and service delivery to respond to the growing demand, as we explained earlier. And a bit on the specific objectives, we are trying to create a space for exchange on expertise and good practices. We want to foster knowledge creation around future hospital models, and you will tell us a bit more about that. And this multi-stakeholder initiative wants to really support a transformation agenda for the hospital sector, both at operational and policy levels. So, more about the series. What can I say? This is the first interview. Sonia, you are the former executive director of the Geneva Sustainability Centre. You're also a member of the board of directors of the Climate Action Accelerator. And as I said earlier, one of the founding members of this initiative. Our overarching question today will be why an initiative on the future of hospitals and their health systems, and you're going to tell us about that in a minute. We'll spend the first 30 minutes hearing from you, then the audience can post questions in the Q&A tab, and our colleagues here will share the relevant questions with us. And I've spoken enough for this introduction, so now it's your turn, Sonia. Can you introduce yourself and describe your vision of the future of hospitals, and how do you approach this question?
Thank you very much, Alexandre, and I'd like to just thank the Climate Action Accelerator for, being the secretariat for this important initiative. It used to be the Geneva Sustainability Centre that was part of the International Hospital Federation, and now it's the Climate Action Accelerator. And it's really a coalition of lots of different organizations who are interested in making sure that we think through the models that we need to have for future hospitals and health systems. And I guess for me, this is, it's become important because we've got so many different crises and challenges and opportunities that are facing hospitals and their health systems. And, whether you look at it from a resources perspective, be it human resources, where in a lot of different settings, people are struggling to have the personnel they need to be able to fulfill the care in the way that we've been used to, whether it's the use of planetary resources, that we know we're, using up far too quickly, and the health sector is one of the components of that use, or whether it's to do with, the fact that with supply chains and their resilience, we've had a pandemic in the health sector recently, which has really made us think very differently about the things that we use as we run hospitals or deliver care, the technological innovations, but also, how do you finance health systems? There's a lot of difficulties now in working out how you can make sure everyone has good access to healthcare, so that they're not out of pocket. So for me, this is a real opportunity for all of us to join forces, share our expertise, to try and see how we can really improve health for all, improve quality of care, and try and, it's an opportunity to integrate these different elements into a same strategy and try and build on the win-win. So there's only stuff to look forward to. I think why lower resource settings? I think, we've discussed what you call it, but the concept that there's certain parts of the world where people are really hit badly by climate change, where financing becomes even more crucial, where access to healthcare is incredibly difficult, where some of these challenges come to the fore even quicker. My hope is maybe some of these places will help us find the solutions quicker as well. So that's part of why the initiative came about. That's why I think it's so important. And I think everybody from certainly the 5 founding organizations is committed to try and work on what these solutions might look like. I mean, we don't know all the answers, otherwise we wouldn't be here talking about it. This is really about trying to bring in some of that to a common agenda and to share our expertise.
Okay, thank you very much. So you took through some of the issues, explained the focus on the vulnerable and low resource settings. I've heard there's a bit of equity also by choosing them, yes, and that some of the solutions for the future of hospitals could come from them. I think it's important for the start of this series that you explain why was this initiative created a bit more, and also how did that happen concretely?
Well, concretely, I think there was a thread of discussion at one of the World Hospital Congresses around universal health coverage and what green universal health coverage might look like. So when you think of it like that, it's a sort of easy statement to make. Let's do green UHC. It's a lot harder to find out, well, what does that really look like? So the idea of bringing these very different organizations together, so, from financing, from the French Development Agency, to people who are experts in environmental elements, to people who are, Aga Khan, very focused on making sure that there's the right research for quality of care. They also do environmental aspects in their hospitals that are commendable, and also the people who are maybe focused on looking at the skill mix in hospitals in a different way, so from a human resource capacity, to try and come together and think through, well, what can we learn from each other? How can we use our expertise to develop a model of transformation that might integrate these strategies into one? So, I mean, initially it was started off with, well, okay, let's start having a conversation, and we quickly realized that mostly our organizations worked in silos, and what we wanted to do is to bring that expertise and share it. So, I mean, I for one know very little about financing and how development banks operate, but they are very interested to hear what we've got to say about the criteria maybe that should be applied for financing in health systems when there's so many different challenges going on and evolving a very complex context. So the idea was to be a platform for knowledge exchange and hopefully to develop a model and start testing some of this in real life situations, and to grow from there.
Okay. So you've described a bit of like how it started, the different goals or work streams that we brought together, and some a bit about the objectives. Maybe you could tell us more. How does the initiative aim to transform healthcare systems? So from these work streams, like how does it work and what do we tackle as priorities?
Well, that's going to be something that we need to decide as a community who are interested in this initiative, because the idea to work on the transformation is with the understanding that you don't just do, carbon calculations on one side, or look at quality of care somewhere else, or do a financing initiative on its own. It's about how you can bring these initiatives together to develop a better solution. And I call it an opportunity for deep transformation. But of course, we have to trial out what this looks like. So, there are some thinking that's going on behind, well, what does resilience really look like in a hospital in a very difficult setting, maybe a war setting or in a lower resourced area? How do we bring in the environmental considerations, the financing elements, the quality of care into all of that? The same with vulnerability assessments. Climate Action Accelerator have done that and developed that based on the WHO models in Chad, and that experience of, well, what is it that really matters in those kind of settings is second to none. So it's how that can be then utilized in different places. I hope that in the end we'll have lots of these different facets pulled together so that we're looking at not a crystal ball, but something that it is multifaceted but integrated in the middle. Because the danger otherwise is that all these different components can be competing with each other, and we don't have time for that. We've only got one chance to really start tackling this transformation in a way that's going to be sustainable, resilient, equitable, and that will improve health for people.
Yeah, so following your thoughts, where you're heading to is that, I'll frame it as a question. Do you think this initiative should end up between the core members, but also other members that can join to have some projects to document case studies? There are many ways to do that. And then try to have some lessons that can be transposable. So how would you see this happen?
So you're right to make it, for me, I see this as a growing community. It's not just the 5 founding members, although they were useful to just get our thinking started, because if you're too many at the beginning, you can get confused. But the idea is to grow that and to be able to exchange between experts on the ground, with financing organizations, with researchers, case studies, examples of practice, like a knowledge exchange initiative. And I think for me, the beauty would be bringing in everybody's intelligence into this so that we can develop that even further. I know there's a lot of organizations that sit on the board. There's a lot of other organizations that have been joining the events. We've had some face-to-face ones that have been very positive. People have learned a lot about each other's area of expertise and been surprised sometimes at how others operated. And I think it is a learning curve. So I'm hoping it will grow. There needs to obviously be a governance structure to the initiative, but then being able to showcase the good practice, showcase the solutions, share also maybe sometimes when it doesn't work. We get a lot of learning from things that don't always work, and we need to allow that space as well, so that we can actually move further, move faster, and start seeing it as win-wins, or things that can work together, rather than be you do this or you do that. I think what we've demonstrated is that you can improve quality of care by being more environmentally friendly. You can improve your human resources issues by thinking through how best to attribute the skill mix, or where you might operate. You can improve financing schemes by making sure that you've got the right criteria. So there's only things to gain by sharing this knowledge.
Okay. So you went at the end more towards the knowledge exchange, or
Yes.
what we call community of practice. So that's definitely something the initiative can do, and I'll share something after that. So that's for the question after. I want to come back on what you've described. I'm trying to find the best way. So you've described what we can do in a case studies, criteria for finance, like sharing SOA experiences, case studies. So we understand all this language, but if you were to explain it to a nurse,
yes,
in a healthcare facility, like what could be useful to like a frontline healthcare professional? How would that look like for a person like this in the field?
So we all know that Alexandre is a nurse, which is why we picked on a nurse. But you're right, this needs to make sense to people who are working in healthcare in the settings. I'm an occupational therapist. I would want it to make sense to anybody who's working there. And I think, simply put, for me, it would be about the fact that as a healthcare professional, you can integrate your understanding of the environment, of what contributes to health, and how you can give better care to the person that's in front of you by integrating all of these things. Now, if the hospital that's around you and the health system that's around you also understands that deeply and it's in their strategy, then you've got everything to help you deliver better care. Fundamentally, as a health professional, we want to deliver good care for the patients that are with us, for their communities, but also for the planet. And I think I don't know, maybe you would disagree, but I feel that I'm a health professional because fundamentally I care. And I think that's what draws me into this, but it doesn't mean that it's just about, it's easier to do it knowing that you've got the right people around you who can say this product actually is going to be better for the environment, this way of delivering care will be better. And often, healthcare professionals, nurses, doctors, whoever, they're in a great place to be able to say, this is what you can do even better in this situation, because sometimes we do things that are a bit crazy. We overutilize things when we could do it in a different way. And,
Yeah, so no, maybe in other words, what you're saying is that first-line professionals to make the right choices when they're aware about the situation, they need the enabling environment.
Yes.
Good alternatives to choose, even some tools like procedures to choose the right way and things like this. Okay,
yes,
thank you.
And the leaders to actually say that this matters. And in a hospital or a health system, we also want to make sure that that's understood by the community as well. So patients, students, that's the caring facilities, the people who understand that actually each other without them doing the environment whilst protecting the finances. We are all part of this ecosystem.
So, and that can bring us back a bit to issues. So, same from the perspective of a healthcare professional in the future of hospitals, what are key issues to have in mind? Or what are they realizing in the field that impacts their practice? Can you tell us a bit about that?
Yes, well, I mean, there's so many, but I'll just give some examples. I think that the first thing, maybe if any health professionals are listening, would say, but where do you find the time to integrate any other kind of thought into what we're doing? We're just, we haven't got the time. And I actually believe that it's difficult whilst you're doing the work immediately to find the time to think about it at the same time, of course. But the systems around should be able to find the ways of making it easier and not make any difference to the flow. So, I mean, I'll just give one example, and I often use this one, but, the use of gloves to care for people, it's been demonstrated that you're better washing hands than putting on gloves if you want to care for your patients. And there are ways of encouraging staff to think about whether they really need to wear them or not. And some hospitals who've done this, they've saved an awful lot of gloves, an awful lot of materials, and patients have preferred it as well. So it's been like a whole financial win, less plastics, less materials. When staff have felt better about it, they've had less skin problems because of it, and patients have preferred it. So there's a sort of win-win-win-win around all of that. I think another one that you might suggest, particularly in today's world, where you might run out of some of the core items that you need as a health professional to deliver care. Well, if we had good, more locally based or resilient thinking in our supply chain, so that we are using the right products and they're going to be there when we need them, that would make a huge difference. I mean, people have had to be so creative during the pandemic, during COVID, to reutilize elements, deliver care in different ways. And actually, maybe we don't need to rely on global supply chains quite as much. Maybe there are other ways that we can make this work better. So I think those are just two examples, but there are so many different facets to delivering care that could be done differently, with the knowledge that you're limiting the impacts on the environment, building resilience in the communities, and delivering better care.
Okay, thank you very much. So we're closing a bit on the vision, mission, and that took us to the front line a little bit. You've touched a bit on the different topics of the initiative, but I would like you to repeat them a little bit and move on. What are the concrete interventions and approaches to tackle the priority issues?
Okay.
Maybe, to summarize, because you've touched a lot on that, and then we'll move a bit more on what were the achievements of the initiative.
Yeah.
Things like that.
So just to go back to sorry, I'll just put this back again. Because it's got a magnet and you might not hear me if I don't do this right. It's very clever. So it's a resource thing, you see. A lot of things in healthcare are about resources. And we, be it human resources, because actually in a lot of parts of the world, it's difficult to make sure that you've got the right capacity to support the care that you want to deliver. So there's been a lot of discussion about how can you manage that. There's changes in the skill mix, in who does what kind of interventions, in how you might bring things upstream into prevention, whether you can, for instance, deliver anesthesia in different ways. There are lots of different professions now that are really looking into what can be done differently. So, that's the sort of human resource side. But if you look at resources in a wider sense, it's not just a human, it's also about all the things that we utilize to deliver care. So we've touched on gloves, but 75% of what we utilize in healthcare has an impact on the environment, on the local economy, and so forth. So, the way you might choose to use those can be very different. Food, if you're buying it local, seasonal, you might be able to work with the local economy. I know in some places it's harder, there might be long winters or very dry summers, but they are, it's about thinking through what's right for your environment. Environmental considerations, well, I could talk about this for a long time. But we know that we've got a number of different crises going on with the climate, with biodiversity, at all sorts of levels that we need to be taking into account. And I guess fundamentally, if I were a patient, or I am a patient, I would not want the care that I'm given to be damaging the planet or damaging other people around the world for the sake of giving care to me. And actually, at the moment, that's what we do. So there's something about fundamentally, if that's a principle we believe in, how do we work with that? It's not an easy nut to crack, but there's a lot of people who are starting to say, okay, but actually you can do that and improve quality of care. So I mean, just as an example, we've got these vicious cycles where you've got, with the air pollution we've got at the moment, you've got children getting asthma, they get given more inhalers. The inhalers are damaging to the environment because they've got this gas that damages. And, maybe we could just sort of start looking at it in a slightly different way. And with inhalers in particular, you don't always have to have them with with a potent gas. They can be done with a more innocuous gas, but it could also be done through, a pulverized form. And we know that that's not clinically related. It's to do with culture in different countries where they're used more or less. I mean, an example again around the environment, we need to be more resilient to the changes in the climate. I know from the example that you've worked on in Chad, where one of the key practical actions was to paint all the roofs white so that they don't absorb the heat so much, and it can reduce the inner temperature by several degrees just by doing that one action. There's, in Singapore, there's hospitals where they don't have air conditioning because it's been designed with cooling, because the air comes through the hospital corridors much more. So, those are just two of the key themes. But then we've also got technological innovation. I mean, now everybody's asking the question, how do you use AI to best effect to do this? We know AI has got an environmental cost. How can you make sure that we can improve care in the right way? It can also be a mechanism for solving some of the human capacity issues. But and we've talked about financing, because if you don't have the financing or you don't have it fit the right criteria, well, we're going to be find it difficult to manage this transformation. But the thing I want to come back to, sorry, because I know I've talked about these topics before, is actually it's all about good health for people. And all of these things, if you do them well and integrate them well, they can help deliver better care. And that's where we go back to the concept of green UHC. This is about good quality care for all, so it's accessible to all in every parts of the world. And ultimately, there'll be different examples from different places that will feed into it.
Yeah, something we haven't touched is hospitals and their health systems. And when you say accessible for all, so can you reflect on maybe the articulation between hospitals, their systems, so it reaches all?
Yes, no. So that's a really good point, and it's been very interesting because it's been a core topic of debate. Is it hospitals? Is it health systems? But of course, it's got to be both. It's got to be hospitals and their health systems, because all the primary care, all the care that happens in communities is fundamental to try and make sure that hospitals are only ever used for what they are most needed for. So, most health is not made in hospitals. It's made in people's home environments with support from nurses, communities, teachers in their own environment. So those systems matter hugely. And so it's not just a system of primary care, it's also the system of medicine delivery to the hospitals. It's how all of these facilities are supported, all the nurses on the wards are supported to do the work they need to do. And that's why we always say hospitals and their health systems, even if it's a bit of a mouthful.
Yeah, even their systems, because teachers are included. So I'm going to move a bit to have one or two more questions, but I'm asking the audience to post questions in the Q&A if they have, and my colleagues to put it in the documents, because I think we'll select a few questions from the audience in about 5 minutes. So I have here in my bucket of questions 2 more. So let's move a bit more back to the initiative. So could you describe what you think are the best achievements of the initiative so far? So since the beginning, over the last 2 years, let's say.
Yeah. So one of the biggest sort of successes, I guess, is that it's reached a huge number of people from very different types of organizations in very different places. So there's a community that's been built with which this topic resonates, where people think, yes, we need to tackle this specifically, and yes, we've got a lot of solutions to share, and there's a lot of learning to be taken from it. So, we had an event in Geneva a year and a half ago, and there were a lot of people in the room, and there were like hundreds online. And so it just gives us the sense that this is important to people. It resonates, it means something. The other piece that I'd like to highlight is that, there's been pieces of work that have happened under this initiative, like developing a vulnerability assessment and how that might look like in different countries. The concept of developing criteria for financing has been, discussed and evolved, and will be presented to the Financing the Commons event, which is around development banks getting together and discussing what matters most to them, a bit like this initiative was also discussed at the World Hospital Congress because it matters to healthcare professionals. And I think we've had a number of deep dive expert discussions on some core topics where it's come to light some of the elements that we need to focus on. And I guess, because you're all listening in, it would be really great to know what you feel is important, because this is an ongoing collaborative initiative that needs to bring in everybody's thinking. I guess those are two other things. One is the size of the community. The other is specific examples like the vulnerability assessment that Climate Action Accelerator has developed and tested it on the ground, the criteria for financing that's in development, and there's also a piece of work around resilience in hospitals that's in development. So to me, those are really great elements.
Okay, thank you very much. So what Sonia is referring to is accessible on the webpage of the Future of Hospitals and their health systems, which is at the moment hosted on the International Hospitals Federation. So if you want to have a look at the past sessions, please go there. And if you have feedbacks or ideas, please share in the chat or please ask questions. Do we have questions for the moment? Yeah. I'll ask one more, a bit of an outlook, and then we'll move to the questions of the audience. So for you, what are the next steps and hopes for the initiative's impact globally?
Well, I would hope that we can keep on sharing expertise and start writing up what a model would look like, be much more specific about what the components would be. And then start having case studies that illustrate different elements and be able to start matching organizations with projects that need to happen with the financing people. So doing I don't like to call it a dating game, but a little bit of a matching up between financing projects, organizations that are capable of delivering it, and driving further action. There's so much. I mean, if I just think of another example, Aga Khan have come up with a framework around quality of care, which was discussed, at one of the events, and it's foundational stuff that can be shared and broadened. And I would hope that with this initiative, there's room for any organization who's got projects to deliver to try and find a way of making it happen within the mission and vision of this initiative.
Okay, so some sort of pilot projects involving some people of the initiative.
Yes, and some publications that actually highlight what's come out of it, but also a concept about, well, what are the key elements that would drive the transformation in the right way? Are there some elements that are critical and others less so?
Yeah, and it makes me think of another question that I think of a lot, and maybe some people online the same, so I'll ask you this. It's a bit two questions. First, what is unique in this initiative compared to what is happening in WHO Alliance for Transformative Action on Climate and Health? And soon they're going to launch a community of practice on climate resilient and sustainable healthcare facilities. So what is different from this, or from the work of Healthcare Without Harm, or other initiatives working only on HR? I'm giving a bit of the answer on this. So maybe answer this question, I'll add another one.
I mean, two unique things. One is unique because it brings in organizations that don't normally talk to each other into a same place to try and say, how do we do this together? So, be it financing and quality of care and environmental organizations or human resource elements, there's some and that is a real strength. I'm not saying it doesn't happen elsewhere, but I think that's a real focus, is bringing those different expertise together. And I think the other bit is that this is really about practical solutions on the ground. So it's not big policy initiatives. It's really quite practical. And we do need to roll our sleeves up, make it happen, demonstrate that it works. So to me, those two are there as well. And I wouldn't say, again, that the others aren't practical, but sometimes some organizations spend more time on the policy front, on big ways of describing things. And I think this is about being much more practical.
Okay, thank you. And I forgot the second part of my question, so it comes back to my mind. So now I'm looking at the questions that were asked online. Yeah, one is about the next steps of the initiatives. We answered about the outlook and your hopes. I think we answered about the next steps. So if you have more to say about concrete next steps, please go forward. Yeah, I see a lot of names that I know here. So I say hi to Chepo and Mika. They asked the next two questions. So a question from Chepo Mokadi. He's from South Africa. You know him, working as a sustainability officer. He's part of our community for a long time. So Chepo says, we are experiencing tsunamis and wars globally. How do we build hospital systems that are resilient to these emerging threats? The health sector has strong influence. And what's your advocacy message to global health sectors and decision makers?
Well, I guess thank you for that question. Great question. I don't have all the answers, but one of the things I do feel very strongly is that, because health matters to every single one of us, it's an incredibly important sector to try and position the way society moves forward, regardless. And, if you think of these, you mentioned tsunamis and war, you would always hope that the hospital or the health facility or the health professionals would be the last one standing there to help and care for the community or what is around. So it would be a benefit for us to really think through what that means if you're going to be the last building standing. It might mean that you don't want to be. I worked in a hospital as a volunteer in the Solomon Islands. Well, when the hospital was rebuilt, it was rebuilt within 4 meters of the sea, and it's a place that gets regularly flooded, and it was known at the time that would be the case. It wouldn't have been too difficult to do it inland, quite a bit further inland maybe. I think we need to start thinking not how do we redevelop a hospital or develop health services based on what we know today and what the past has mean. We really need to look at what is the future going to bring to us and how do we prepare to make sure we've got the right setup for that. And if you think about it as being, we owe it to others to be the last setup standing, then there's something about it looks quite different. It means we need to protect supplies. It means we need to have maybe a mechanism for facilities to be able to allow communities to charge up their phones. It has all sorts of different implications, but that's what health is about, actually. So my big message is that health matters and the planet matters, and because health matters so much, we just need to put it front and center in all the discussions. That's my bias.
Okay, I'll continue a bit on this question because so a couple of weeks ago we had this panel discussion at our Acceleration Day, the 25th of March, and you were interviewing Thomas Kergal from the Council of Europe Development Banks, and a bit on a similar questions. He was saying that maybe, I think if I remember well, the framing was like, because the climate angle maybe becomes a bit more important or more in front. Preparing for war becomes more important in Ukraine or in the Middle East at the moment. And he was saying that we need dual purpose. And I would argue we need multi-purpose. So I understand this is important, but back to financing and design of projects, like how does that look like to integrate that you need a phone charging station in your hospitals? Like, what needs to happen so that becomes part of a hospital investment?
So it's a really important question, because with the investments that do go in, making sure that we've got an assessment of the future and what the climate impacts might be, what some of the vulnerabilities around that area might be, and some of the solutions that could help mitigate that are really important to consider at the earliest opportunity. And often that's just at the point where the financing initiative is being discussed and developed. And it would be a shame if it was only finance people in that room having that discussion at that time, and that's why you need people in an initiative like this to bring their expertise and their examples to say, this is what it could look like if you got it right. It doesn't need to be more expensive. Actually, it'd be cheaper if you integrated it at the beginning rather than as an afterthought later on. So for me, let's bring those discussions in at the very beginning.
Yeah, in the concept, feasibility studies, design process.
Exactly.
Yeah. Okay, thank you very much. So we'll move to the next question, which is related. Many NGOs want to move towards planetary health, but they lack financing. In your view, how can we motivate both donors and financing organisms to support the effort?
So it's a good question as well. I do think that this is again a point about silos, but you can show the added value of thinking more broadly, both for financing initiatives to say, actually, it needs to encompass these different elements, and the co-benefits are to health, the co-benefits are to resilience in a population, as much as an NGO might be able to get started on the journey by doing certain things and incorporating it into what they're doing. I don't think you can only start when you've got an extra dollar. You can start thinking differently ahead of that. And I think it will help with applications. It will help show the different benefits that can be derived from it. It's not just one benefit that might be reduced carbon. It might have benefits on biodiversity, on quality of care, on the employment of the local population. And I think it's starting to broaden the way we talk about these things. My view personally is that anybody can get started wherever they are, at whatever stage they are. It's a matter of starting to think differently about it. And that will help bring in innovative ways of thinking about how to apply for financing, where to go, or how to join forces. I think a lot of the initiatives that are being built up at the moment are several funders coming together to try out with several partners or NGOs to get the implementation right, because everybody's realizing you need that multiple expertise.
Yeah, and also their motivation is that because the question before we talked about being prepared to many risks, now we're saying you should start by you, and then you can show you've done what you could and you can do more, but if you have more funding. And the motivation of financiers is to know that if we don't prepare or if we don't start with existing resources, then it will cost later, right?
Yes.
That's their motivation.
Exactly. It is cheaper to do it now than later.
Yeah.
Okay. As a basic economic fact.
We go to the cost of inaction. Maybe back to your question, Mikael. The key motivation is that what is not done now to these future or emerging and future issues will cost
a lot
lives
and impact on lives. I think that's exactly.
Yeah, thank you very much. I'm reading to the next two questions. Interesting. In your opinion, what could be the best way for hospitals in low-resource countries to collaborate with the Future of Hospitals and Health Systems initiative? So the best way for them to collaborate with the initiative.
Great. Well, I think the best way to collaborate is to link in to the people who are acting as secretariat, which at the moment is a Climate Action Accelerator. I think telling us what are the sorts of things that would really make a difference to you. Are there, because this is an initiative which is trying to address the key themes as seen by all of you, to make a difference. So if you feel that there's something that we've talked about that's missing, or that we've talked about that's right, or something that we've missed completely, or something that's particularly important, I think it would be really key to let us know, because then we can try and weave it in. I think if you've got, we're not quite at the stage where we can say, yes, send us all your projects and we'll try and match you with financing people. I don't think we're quite there, but that's part of the reason why we're looking at how to make it happen and where the key themes are. I think the French Development Agency are very keen to be able to identify concrete projects, identify great experts, and the right financing mechanisms so that it's all aligned. And we need to support the way we can to make that happen. Yeah.
Okay, thank you very much. And maybe to add to that, in practice, many hospitals in low resource settings, they engage with the initiative, the ones who work on the French Development Agency projects, the one we support in vulnerability and capacity assessment in Chad, South Africa, Senegal, Bangladesh, La Chaîne de l'Espoir, Aga Khan Health Services. Aga Khan Health Services is delivering healthcare for, I think, 18 million people.
Yes.
So there are a lot already engaged. If you need direct contact with the whole initiative, please reach out.
Yes, you're right that you might be very close to one of the organizations that's already part of the initiative, but if you're not, I'm sure there's ways of integrating.
Yeah, and actually we're going to a National Hospital Association now. So it's a question from Leah Partakuzuma. I hope I don't scratch the name. I'm going to summarize it, but I've read through it. So the perspective is then from Indonesia. So at the beginning, initiatives were introduced as green hospitals, green hospital concept, then environmental and sustainability governance. More recently, it's the concept of net zero carbon.
Yes.
So good job, Race to Zero, to have come to the hospital sector. And I know you've worked a lot on this too. And then the question, we have a lot of this question also in the planetary health communities, and with the One Health.
Yes.
So to add me,
all these different terminology, that's fine.
So would it be more effective to adopt one overarching term or concept to guide implementation?
Well, it's a really great question, Dr. Leah, and it's nice that you're here. Thank you for joining. I'm going to say something that might sound awful, but I don't think the words or the terminology matters that much because it keeps changing and evolving. Unfortunately, we have words, be it sustainability, be it low carbon, be it whatever, and people get tired of it, or they think it's not cool anymore, or it might have more emphasis in one country than another. So we've got to learn to dance with it. The concepts behind all of those are very similar. It's about how we can protect our environment, how we can improve health, how we can avoid wasting resources unnecessarily, And actually, if we need to every 5 years find a new catchphrase, okay, fine. But it's not changing the fundamentals, I don't think.
Yeah.
So that's my view. And I didn't use the word, some words are sexy. Net zero is sexy for a while, but then it might not be. Planetary health as well. But there'll be another word somewhere in the next 5 years. I'm sure that people will say, this is the word now. So we shouldn't get too tied to it. I think it's the principles and the concepts that underlie it that are longer lasting, because I've been talking about environmental issues forever. And sometimes I feel we haven't progressed much, but we have actually. And that gives me hope.
Yeah, thank you very much. I came to the same kind of perspective. And also, I think, to add on what you say, I think the diversity is important.
Yes.
So because these concepts, they are communities also. So maybe they speak to some people, or a terminology, and another term speaks to another one. So maybe green hospital talks better to infrastructure engineering.
Yes.
Maybe the governance ESG talks more to the leadership, and net zero is more climate and health specialists.
Yes, it's a form of accounting, but at the end of the day, they're all part of the same concept, which is we need to look after our environment, improve health, you know, and actually support our communities. And to, you know, so I wouldn't worry too much about it. And, you know, we said green UHC, but now we're talking about the future of hospitals and health systems. And it's the very reason why this initiative has come together, is to try and make sure that we bring all this together without the words getting in the way.
Thank you. Yeah. And what comes to mind, would you say that maybe an important aspect is to explain those in simple terms to convince more people?
Yes, but at the same time, yes, I think so. But if we're always explaining new terms, you can lose people and they get bored. I mean, I would just think, oh, really?
Yeah, that's why I say simple terms, yes. As you said, it's to improve the health of people while not damaging the environment, etc.
It's exactly
so what is
that.
Behind the term?
Yes, what are the concepts that are underneath it, or the principles, or the philosophy? Yeah, I agree.
Okay, thank you very much. We're in the last 4 minutes, so I'm sorry for the last question. We won't take it, but I think we've answered that. If not, we will keep it for our next session, because that's very close to the work of the Climate Action Accelerator. So we move to the closing remarks. I want to ask you as a last closing remark. So first, thank you very much for all your insights. We already have comments that it's very informative. So well done. Thank you very much.
Thank you. Questions?
What is your final word about why is this work so important?
So for me, this work is so important because it's about health. Health matters to every single one of us, and we all have the power to do something about it. And do you know what? When we're talking about this sort of difficult context in the world at the moment, it gives me hope that there's things that we can work on to improve matters. You know, that's how I get up in the morning.
Okay, oh, that's beautiful. Thank you very much. So I'm going to use now 2-3 minutes to close the session. So again, thank you very much, Sonia, for all your insights. I always love how inspirational are your talks. So thanks for sharing with us. And thank you also for starting this initiative. Maybe I didn't say it enough at the beginning, but Sonia, you started this initiative with the Geneva Sustainability Centre.
Yes, with the help of a lot of colleagues and other organizations.
Maybe that's another takeaway. Like you should ally with people interested in your topics to do more together.
Yes, exactly.
That's easier. So now you've left the Geneva Sustainability Centre, so that was good to have you to explain the beginning of this initiative. The secretariat has now moved from the Geneva Sustainability Centre to the Climate Action Accelerator, so we're going to take care of it for 2026, and we'll see what comes next in the initiative. I'll tell a bit more about the perspective this year. So since the Climate Action Accelerator is taking the secretariat, we will put a kind of a climate coloration to the secretariat, of course. That means having climate as a cross-cutting issue when it comes to HR or human resources, when it comes to quality of care, when it comes to financing, of course, also technology, the trade-offs between around digital health, what is frugal, good digital health is an important one. So we're getting organized together. There will be a series of interviews. So what we're going to do from everything you've shared today, we'll identify 3-4 key questions and then identify speakers to answer these questions in the coming months. So I think there will be 2 other talks before the summer and 2 others in the spring. And beyond this, there is the World Hospital Congress happening in South Korea in November, if I'm not mistaken, or October or November. We can share that, and it's accessible on the website of the International Hospital Federation. And our partners that are not here today, the Geneva Sustainability Centre, the French Development Agency, La Chaîne de l'Espoir, the French NGO, and Aga Khan Health Services, they're going to put together some events on the topics you're discussing. So please register to our newsletter on the website. Please reach out to the Climate Action Accelerator if you want to engage with the initiative or know more. And voila, I thank you very much, Sonia, again
thank you.
The chat today, and thank you for the audience for listening. This live webinar has been recorded and will be posted online, and we also do a podcast out of it.
No, thank you.
Thank you very much. Thank you very much, Sonia.
Thank you. Thank you, everybody, for joining us today.